Good morning, everybody. Welcome to the Health and Social Care Overview and Scrutiny panel. I would like to do a little bit of housekeeping first. Fire alarm. A fire practice is not expected. If the alarm sounds, can all present leave the building as quickly as possible by way of the nearest exit. The designated assembly point is in the public square in front of Cast, beyond the fountain, away from the civic office. If there's anybody with mobility issues, please wait in the refuge area at the top of the stairs where the emergency evacuation lift is located, and use the intercom situated to the left-hand side of the lift doors to call for assistance. No roll call will be undertaken. Thank you. Mobile phones and laptops, if you can turn them to silent, please, to ensure everyone... oh, it's all right. Filming at the meeting. This meeting will be audio-visually recorded and will be available to view on the Council's website and YouTube channel. Can I ask all those that are present to use the microphones to ensure the audio can be captured? Any members of the public entering the council chamber are accepting that their images will be retained and broadcast by the council. Thank you. Introductions. Please can I ask that everyone introduce themselves, starting with myself. Councillor Hollingworth, Chair of the meeting.
Good morning, David Cowell, Vice Chair.
Gerald Squire, Asken Council Ward.
Good morning, Nick Pritchard, representing Armthorpe Ward.
Thank you, Councillor Jenkins, Wheatley Hills and Intake.
I'm Councillor Ken Guest and I represent Rosington and Bawtry Ward.
Good morning, I'm Rachel Leslie. I'm Director of Public Health here at Doncaster Council.
Morning everybody, I'm Caroline Temperton, the Public Health Lead for Healthy Places at Doncaster Council.
Morning everyone, I'm Kerry Perusa, the Strategic Transportation Manager at Doncaster Council.
Good morning everyone, I'm Jodie Bridger, Senior Partnerships Manager for Get Doncaster Moving.
Morning all, I'm Andy Maddox, I'm Strategic and Service Lead for Leisure Services and have overall responsibility for Get Doncaster Moving.
Good morning, Councillor David Nevitt, Portfolio Holder for Health, Adults and Culture.
Thank you. Caroline will read the apologies.
So apologies for absence, just Councillor Vicky Lawson.
To consider the extent of, if any, to which the public and press are to be excluded from the meeting. There are no issues on the agenda which requires the exclusion of the press or public. Declarations of interest, if any. If you have an interest, please declare this and a form need to be completed following the meeting. Please contact Caroline Martin, who can assist you with this process. Public statement.
No one in attendance from the public.
Oh, yeah.
Oh, it's okay.
Right. Minutes of the Health and Adult Social Care Overview and Scrutiny panel held on the 2nd of October 2025, pages 1 to 16. To agree as a correct record, are they agreed? Are they seconded? Thank you. Items where the public and press may not be excluded. Reducing physical inactivity in Doncaster to improve cardiovascular health and healthy life expectancy at population level, pages 17 to 26. I would like to introduce officers to provide a short overview of the report.
Thank you, Councillor Hollingsworth. I'll just provide an introduction and then Andy has got some presentation to make as well. So we're really pleased to have the opportunity to share this report and this information with the scrutiny panel today. I thought I'd provide just a reminder about why this topic was chosen, because we had a different chair in place when we made the work plan at the start of this year. So as usual, when we're helping the panel with its work plan, we present some key statistics and data about Doncaster's health and well-being. And as part of that, we reported that life expectancy, and particularly healthy life expectancy, was low in Doncaster. So the number of years that people were living in poor health is higher in Doncaster than it is in other places. And there are a number of deaths that are described as unavoidable, related to things like cardiovascular disease and higher levels of cancer. When we were asked for some of the reasons about this when we were planning for the work plan, we talked about a number of different causes, but we talked about a number of opportunities to improve people's cardiovascular health, so improve their chance of a longer life, but also a healthier, longer life. Now, there's a number of things that can improve people's cardiovascular health and reduce the risk of them having heart disease or other heart conditions. They include stopping or reducing smoking. If you have diabetes, then managing diabetes really well, reducing levels of alcohol consumption, having a positive network of friends and family also, and managing stress. But one of the real assets, one of the real benefits, one of the real things that really works for cardiovascular health and a number of other health conditions is a good level of physical activity. And as a local authority, we've got an opportunity and a duty to create the conditions for physical activity, for people being physically active in their day-to-day lives. We'll focus today on cardiovascular disease, but in the report we've described a number of benefits of physical activity. These include our programme Dance On, which has reduced the risk of falls in our older population. We've had interventions where people have undergone a programme of physical activity before an operation or before a medical event, and this has meant that they've had a reduction in their bed days, so they've been able to leave hospital earlier and get home to their families more quickly. It's one of the number one treatments physical activity is for management of anxiety, and provides better sleep, and it slows the progression of things like dementia as well. So a real opportunity as physical activity to improve the health of Doncaster residents on that population level. We've been working on Get Doncaster Moving for a number of years, and the report and the presentation that Andy will give in just a moment will describe the approach that we've made and some of the benefits that we've realised for our Doncaster population. So I'll hand over to Andy.
Thank you. Hopefully, can you hear me now with that stood here? Is that picking me up? Okay, so apologies, I'm full of cold, so that's not really a good, healthy start this morning, but I'll soldier through, as they say. Yeah, as Rachel's just highlighted, I'm here just to give you an overview of our approach, and then we'll be answering questions after that. I think it's essential we do that discussion around our approach because we are doing things differently in Doncaster. We are nationally and internationally recognised as leaders in this work, and specifically in some core areas as well. As we're sat around today, we've got colleagues with me today, but we could have had colleagues from a number of areas of work in there. We could have had, as Rachel's mentioned, people from dance and the cultural sector. We could have had people from the leisure sector, the planning sector, business sector, clubs, community organisations. All of those make the rich tapestry of what Get Doncaster Moving is and how we work together. So I'm just going to take you through a few slides here that explains our journey. Our journey has been some time, so this has not happened overnight, and it's still got a long way to go. But we are making strides and we are making a big difference. Okay, so we have a common purpose. This is what we corral around, and that's healthy, vibrant communities through movement, physical activity and sport. We call that our elevator pitch. If you ask me what I do, I help communities become healthy and vibrant and reduce inequalities. Okay. I can't do that alone. I have to do that with a massive group of people that support that work. And that's not my workforce, that's people who buy into that common purpose. So we're here to help our population improve their lives and become healthy and vibrant, and therefore play a greater part in the social fabric of our city, our communities, our region. And by doing that, help them grow and be better persons and actually enjoy life better. When did it all start? So I'm not sure if many people are around here, but this is June 26, 2012. Okay. This is Ben Parkinson carrying the Olympic torch. We decided to host the Olympic torch on that day. 15 miles. We had the largest footprint outside of London of hosting the Olympic torch. Why do I reference this? At that point, our work consisted of 2 people and a budget of £5,000. That's for the whole population of Doncaster, 315,000 people. That's where sport and physical activity sat at that time. It wasn't seen as a tool, it was an enabler to do other things. What happened on that day, we had tens of thousands of people across the whole route came and watched. We saw what we call social impact. It had a massive impact on both the political executive, both on the population and on the people that make the decisions. At that point, we decided to figure out, why did that happen? Why did sport or physical activity, something associated with it, have such a big impact on the population and be a sparkler moment that people have talked about for years afterwards and enjoy? So we started investigating that and we started working forward on that. As you all know, Doncaster has an IMD decile quite poor in a number of areas. Okay? What we do here is we focus on that. We actually narrow our focus on some core areas. We've got 15 we're working in very strategically, very surgically. However, we do a population approach as well. Because if you are rich and you have health and wealth there, you can lose that if you're not physically active. And that then puts a burden on society. So we do focus predominantly on those areas that we need to, but we don't just leave the rest of the population behind. We work on a population approach as well. And that's very unusual for this work. Okay. Most places that we work in focus on some very finite things and then try and distribute that learning. But we do a slightly different approach here, and that's why it's working quite well. Also at this time, in 2018, we became a Sport England local delivery pilot. What that meant is we were one of 12 places selected by Sport England to test a way of working that actually increases physical activity levels. Because up until that time, physical activity levels had flatlined. Okay? The Olympics didn't have the change or the difference that they anticipated it to do. So what was going wrong with the way we approached? And we tried numerous different approaches to understand that. And we think we now understand how to enable communities to actually choose for themselves to be active, because that's the crucial bit. People need to choose for themselves. We can't actually tell them to do it. We can enable them to do it and work strengths-based with them to make that choice and enable them through many different facets of life. We have a set of principles we work to, okay? And these are our sort of moral compass, our guiding light, and we set these in our very early days. So when in 2018 we became a local delivery pilot for Sport England, we set these principles down hard. That's because at that point in time, we then suddenly went from a very small budget to a significant amount of revenue money and capital money we could access if we could prove the value of it. And over that period, we have, by 2028, we'll have accessed roughly around £23 million from Sport England alone to do this work. That's capital and revenue. So Ascot Leisure Centre, that got £900,000 of Sport England, but we used it in a very different way to connect with the country park, to make that an active environment, not to invest purely into the leisure centre. So we invest where we have the evidence and how it works, and that's seen positive action there with large numbers of people using those facilities. However, when we talk about our focus is those middle groups in there. Inactive people, families and children, people on low incomes. Very much focusing on that, because we know we will get the best return for our investments on that for society, for the public purse, but more important for the health and well-being of those individuals. If we can help them move from being inactive to active, there's a big difference between moving people who are active to be more active. Inactive is doing less than 30 minutes activity a week for an adult. That's being sedentary. Okay, we've got some places in Doncaster where they don't even reach that level, or they didn't. Okay, we worked hard to shift that down. What we've also got wrapped around here is a number of key themes we work to within our principles, and I'll just point a few out in there. One of them is we're value for money. We're true Yorkshire people. I've got short arms and deep pockets. So the money we've got off Sport England actually goes a long way because we actually look at fostering relationships that brings other resources in that helps us to deliver that. So we don't have to cover that directly from our budgets or our money. Our money can go further, enable more activity, enable more access to the programmes. We avoid duplication. We've had a lot of that in the past where one agency delivers something here and then something delivered over here, very similar. So what we do is bring collaborations together so we avoid the duplication, again maximising the resources. And we are very much about anyone can be a leader. I'm going to talk about a distributed leadership model. We are not the leaders of this in the sense we control it. We champion it. We enable people to do that. And after this presentation today, I'm hoping that you become our champions and our distributed leaders of this way of working. And we're led by communities, which is a key. Okay, strengths-based approach. Let's find what's strong in the communities. Let's work with the communities to understand that. We've got a number of ways we do that, and we've been very successful in it. We listen, but we enable the communities to do the work, the people to do the work, and to engage in it. We don't do two. Okay. Well, our structure is very light. We have a small advisory board, so it's not a formal board. It's there just to advise us, and that has people like the CEO of the Leisure Trust on there, the CEO of the Club Foundation, for Club Doncaster, Rachel's on there as well. We have community members, etc. And they're sort of our litmus test. We meet bi-monthly and we present to them. And they do a number of things for us. They endorse our work, so we present to them and they endorse our work and say, yeah, that's landing there. They check and challenge us quite a lot. Is that right? Is that working? We've heard this here. I think you need to go away and think more about it. And they unlock doors for us. Because of their relationships with other agencies, they unlock doors for us and help us get to places we previously weren't being able to get to. We have the team. So the team is not just Jodie, I, and 5 others in my direct team. It includes everybody that is within the service areas that can enact on it. So Kerry's part, we see Kerry's part of the team, Caroline part of the team, and we could even extend that to our network of partners, which I'll speak to in about a minute. Individuals and communities are at the heart of it, as I've said, and we are led by them. And groups and organisations are key delivery for us, and we work with them to enable that. Our team, we have, as I say, there's 7 of us, and it's a small backbone function, and these are what we do. We do not deliver. Okay. Previously, you would expect a local authority team to run sessions. In the old days where you'd have gone out with a bag of balls and actually done football sessions in holiday camps or done this. That is time limited, that's not sustainable, and it doesn't have the impact. So what the team does, it guides vision, it supports underlying approaches, it establishes shared monitoring and measuring, so we are very tight on our monitoring and measuring, and I think you can ask us some questions about that. So we have a lot of evidence base to monitor and measure to do that. We advance policy, so I'll talk about policy later, and we mobilise funding investment, so I'm talking about that funding investment that we unlock to do things. It doesn't directly come to us, but we enable other agencies to actually spend their funding. That helps us do that. So this is how we align this to the Team Doncaster and the Great 8, the strategic vision for the borough. So in the centre of that is that common purpose. That is our sort of mantra in there. And then around that, as you on the outside of the ring, you will have the Great 8 themes that we do. And each of those, you can see how we align our work. This is just a big snapshot of each piece of our work. So if I took the healthcare one down the bottom right there, it says healthcare. In that, I could list you at least a dozen different things we're doing at a strategic level that's having impact. That could be pre-rectal cancer. We're working with the Mexborough Hospital on engaging people in activity before they have rectal cancer operations, because we know, and it's been proven, the work we've done is that it reduces bed stays. By reducing bed stays, it doesn't necessarily save money, it just enables them to get the next person in quicker to have their operation and become healthy. We work with cardiac teams to do cardiac work, which we'll mention, and we're starting to work on talking therapies with RDASH on a long-term 3-year programme on there. That's just 3 examples I can give you there. We talk about active education. We do a programme creating active schools, where we work with schools to actually embed physical activity, not like PE, but in the whole governance structure of the school. So everybody has a role around making children physically active. And that could be as simple as extending lunch times by 10 minutes, so children have the time to walk and get to lunch and have the time to walk back without pressuring them, etc. There's a whole programme around that. And we have similar ones for all those other things. So it's not just one thing. In those, there's a multiple of things that we're doing around those. We have a bottom-up approach. So we work very closely with Doncaster and our teams in public health. So we have an appreciative inquiry approach, which you may be aware of around that, is around strengths-based, listening to communities, working from the strengths and doing that way. We have community profiles, so we understand the community profiles, etc. And they were very relevant if I talk about asking again, about deciding how we invested the money into the leisure centre there. It wasn't a traditional investment. That's why Sporting put nearly £1 million into there. We have community-led plans. Those community-led plans actually drive our decision-making and actually guide us. And we have positive activity groups that actually enable us to listen and work with the community. So that's a complete feedback loop, constantly working. So it enables us to actually do the activity. We connect up and across the system. So these are particularly focus groups that we've set up around there. So schools, dance, communications, etc. These are constantly evolving and new ones are establishing as we work through. So these ones are the big driver items. We find we've got energy in the system there, and what that enables us to do is then to actually work harder with them to actually grow that physical activity measure and actually make people more active. And in the centre of that, we have a network meeting where our whole network can come together 4 times a year and with one summit as well, where we actually enable them to spend time to actually discuss and learn and develop programs. And from that, we've seen a number of successes where partnerships have grown, extra funding's come in, and new organisations have developed to do that. So, technical glitch. Don't know why that's happening, Caroline. Sorry about that.
Is it moving on now? It's not there. Only thing is to reboot this. Do you want to have a I'll try that.
Yeah, that's it. Got it. So, reboot. Switch it on and switch it off if you don't. So talk about our style of working. So we are moving we talk about distributed leadership style. We want everybody to have ownership of this. So in a leadership style, very simply, you can have a centralised leadership style. One person at the centre controls all, okay, and just sends messages out, I want this doing, and then comes back and that's been done, then sends the next message out. It's not very effective, it loses people, etc. We move then to a decentralised system where actually people are given leadership responsibility, and that's more traditionally where people work at the moment, okay. Organisations like this tend to be in that place, okay? Larger organisations, community clubs do with a committee, etc. Even political systems tend to work in that fashion. What we need to do is move to utopia, which is distributed leadership, which is the C1 there. We'll never ever get to that because it's a perfect model, and you can't ever get to a perfect model like that because there's the nuances, there's lots of complexity in it. But by moving to a distributed leadership model where everybody feels they have ownership, everybody feels they can lead what they can do in there with the autonomy to do it, permission to proceed and proceed with permission, gives them the power to do what they need to do on the ground without having to wait. It speeds things up, it makes it more fluid, and it's fleet of foot so things can change quickly to the needs and wants of communities and people. Okay. So we spend a lot of time developing that and moving that forward. How do we know that works? Well, first of all, we use a social ecological diagram. And this is what we call the onion model. It's like the skins of an onion. In the first 3 is traditionally where we've worked in sport, leisure, physical activity. We've worked with individual, we've worked with family social groups, clubs, organisations and institutions, that delivering things to people, which is great. There's a big need for that. But also what we need to do is think about the physical environment, hence why we've got Kerry and Caroline here today, and we need to talk about the policy environment. Okay? We need policies to enact on that to enable us to do. So what we do in Get Doncaster Moving is work across all those layers, and we can give you examples for all of those how we've impacted. So policy, we've got a play infrastructure policy about playgrounds in Doncaster. Until we did that policy, we didn't even know how many playgrounds we had in the borough that were not owned by the authority, and the quality and the measure of those. So we've got a policy there, we're working on the policies, all the way to working to individuals to enable them to be physically active. We also know what the system is, so we're looking at systemic change. We mapped it very early. It's complex, okay? We can go into a whole discussion around that at a later stage, but essentially what we have here is an ability for us to actually understand the complexity of the system and what enacts on it. So if you look down the bottom left in the circle there, motivation. Motivating people is a key thing around physical activity. Everybody knows being physically active is good for their health. Doesn't matter who you are, everybody's heard that, but do we do it? Because if we did it, I wouldn't be stood here today. We wouldn't be having to do this, it would just be natural, but it isn't, because motivation, the skills to motivate people, the ability, combi theory, capability to do it, opportunity to do it, and the motivation to do it. We need to have all those three working equally to enable people to be able to become physically active and therefore reduce health indices. And we talk about cardiovascular. Okay. I'm a prime example. I have had cardiovascular surgery. I was on a bike in 2016, didn't feel very well, went to the doctors, I needed a stent fitting the following week. The surgeon said to me, if you didn't come in this week, most likely you may have had a stroke next week or would have found you dead by the roadside. I exercised a lot. So I exercise a lot. It's just my physiologically, how my arteries were there. It had a kink in an artery, nothing to do. I couldn't do anything about it. But I was back in work a week later after the surgery because I'd been physically active. I was motivated to continue being active after that to keep my health, so that didn't reoccur. So I had a personal motivation around that. But before it, I was motivated to be active for a different reason. So motivation changes through life courses as well. And we talk about the journey so far. So we talk about our network. Our network is everybody we work with and others as well. So in 2018, we've mapped it every year since we started this work with Sport England. In 2018, there was 98 individuals in that network. By 2024, and this year, we've got about just over 1,500. Hasn't grown significantly between 24 and 25, but what we've got there is those colours represent different groups. So the oranges represent communities, the sort of the purples, the sort of the top, sort of just top 11 o'clock-ish on the 25 diagram is all the primary schools. What you'll see there is all those dark lines, etc. What those lines are telling us is that they measure the relationship. We can measure how strong that relationship between us and them or other organisations are. And what we want them to do is not speak to us, is speak to each other. And we do that every year through an academic process that enables us to know how strong that relationship is. What is happening is the network's not growing dramatically now, but the strength of it is getting stronger. So if we're not here when the funding finishes in 28, that network will stay and work together, and that is a key part of our work. They want to do our work now for us, and that's what we are really focusing on. What laser-like focus for the next 3 years is to enable that network to grow and develop, so that if we aren't here, it will continue. And this shows you the strength. In 24, you can see the network there. The grey lines are not that strong. If you look at 25, you see how dark those lines are and how dense it is. That means they are working stronger together. I don't know 95% of those people in that network. Okay, they probably heard my name but don't know me, but they are doing the work for us now. And that is our end goal, is that they do it, we enable it. Okay. So we do things by evidence and we do things differently, you've probably heard. So if we just flip around here very quickly, left-hand one there, tennis. We had a battle with the Lawn Tennis Association for 2 years. They wanted to put keypads. They would freely surface our courts. So we get brand new courts, nets, etc. Lovely. They needed an electronic keypad to put on it. What we said is no, because what we know from our evidence and speaking to other agencies is that those people on low incomes don't trust electronic systems. Not necessarily because they're digitally disadvantaged, but because they think we share their data with other departments. And therefore, if you're not in work and you're on benefits, etc., but you think physical activity is a good tool to get you healthy, which it is, and we want them to be back in work, if going and playing tennis on one of those courts is what you want to do, is that data shared and it stops me getting certain benefits or stops me getting certain help. So we had a battle with the LTA. We got an agreement where we've got we've got 3 courts that are not gated in our areas that we're working in, and our court that is gated is in one of our most affluent areas. I won't mention the area. What we have found is all 3 courts that aren't gated, haven't been vandalised, haven't been attacked, have multiple use, and the chap on the right there is Volunteer of the Year for Yorkshire LTA that we enable to work with tennis. What we found in our most affluent area, the gate key has been kicked off the gate 4 times, so we're not putting it back on now. It's been vandalised where it hasn't on the others. Don't know what that tells you, but that is about ownership, etc. There's a whole behaviour thing around that. Right-hand top is very quickly, is we have teenage shelters in our parks. If I'm going to be really honest, who designs a shelter that's got metal bars all the way around it, a metal roof and metal seats, and expects children to enjoy sitting in it? Okay, it doesn't sound like a nice environment to me. So we work with the group of young people from Doncaster College, and that's what they want for teenage shelters. They want them to be open so they can be seen, because being seen makes them feel safe. They want the benches facing each other because it stops what they call the wet bum syndrome. Okay? We put our benches in parks next to each other. So I sit like this. If I want to speak to somebody else, they're sat here like this, aren't they? And you're talking like that. Is that natural? No, it's not. We want to face each other. So by just putting the benches face to face, we change people's behaviours, and it enables those young people to use that park safely. By getting people in parks, more people in parks makes people feel safe. CCTV does not make people feel safe. Everybody wants CCTV. It does not make people feel safe. Evidence tells us that. Having people in parks and open spaces, being active in those spaces, makes them feel safe. Then the last one is, this is equipment we put in at Askham. It's inert equipment, it's power-assisted gym equipment. People went, why are you doing that? We targeted because Askham's got an ageing population. It's got a lot of health issues with that ageing population. This was designed to help them. We have full membership at Askham within 18 months, and 65% of the people who have signed up to use that equipment are over the age of 60. So we hit the target audience by putting the right equipment, by listening to them and using evidence to design it. So we are impacting on the health. And I urge you all, if you want to, go and have a look at and speak to the people using that equipment, because it's transformational there. And we informed decision, talk about policy earlier. So we've done a response to parliamentary call-outs, which that evidence has been used. We are currently speaking with the Australian government about them learning about our ways of working, their sports there, because they've just written their first ever sports strategy. We work heavily with Sport England and advise them. Both Jodie and I are speaking to virtually the whole of Sport England on the 11th of December. We're working with them on that. And we have strategies and policies internally that decide decision making. So we work with people, we enable people to do things, we fund programs to be done or delivery, we deal with the policy. That social ecological diagram, that onion diagram I show, we work across all spans of that, because to actually make this work, we have to impact all of those. We can't just focus one or the other. And this is our journey. We do a journey map every year. So the left-hand one is 2018. That is every one of those blue dots on there, those right circles, is everything we did in 2018. 2024's journey there has probably about a quarter of what we did in 2024. And we can talk about each one of those and how those impacts, and they range from things like running the Tour of Britain that came through, all the way through to policy work, all the way through to enable community groups to access grants, or enabling buildings to be built or designed and developed, or working with Kerry and her teams, working with the health sector, working with the cultural sector. So that is our journey. It shows the movement we have each year and the growth of the work. That's me done. Hopefully that's give you a bit of a snapshot of who we are. Let's get Doncaster moving and what we do and our approach. Okay, but open to questions now. Thank you.
Thank you. That was a lovely lot of slides that you put there. You took a lot of time. Thank you very much. I would like to now move on to questions with Councillor David Carroll taking the first question.
Hi, good morning, everybody. Just looking forwards, page 21, number 27, looking forward to the next 3 years. The GDM priority is to ensure the network's growth so that the impact can be sustained in the long term, but with a continued focus on these inactive people, on low incomes and families with children. When will this actually start, and will you measure this on a yearly basis, to see what progress is being made?
Yeah, so I think between Jodie and Andy, so you've seen some of the how do we measure it in the presentation, but yeah, we'll take you through what the work is to develop the network and then how we measure the progress for those groups of people as well. Go on, Jodie.
Thank you, Councillor. So, as you'll have seen in Andy's presentation, that growing and developing the network is a constant piece of work for us. And as you've seen, we use social network analysis, which started in 2018, to measure the growth of the people, groups and organisations involved in what we're doing in our shared ambition. And there's loads of different ways that the network partners, depending on what type of organisation you are, what focus you are, what part of the borough you work in, etc., can get involved and take action to support people on low incomes, inactive people and young people with mental health. So, for example, we're working with the NHS Trust, with GP surgeries, with healthcare professionals, particularly around mental health. There's a huge focus across all ages, bringing them into the network and connecting them with different providers of activities as well, so they can signpost and refer, etc. One of the main things that we're really proud of is the progress we've made around our Active Communities grants, which enable local groups and community organisations to access relatively small amounts of money, but to do huge things in communities for local people to access. Because we recognise the borough is quite a large one, it's quite difficult for people to move about and access opportunities across in different parts of the borough. So it's really important, and residents have told us it's important for opportunities to be available close to where they live. So the grants enable us, or groups, to take hold of that and design and develop stuff locally to them. And the same with the community connectors. So we are investing in 7 organisations to host connectors, again, which help to signpost and guide people to activities near them, particularly people on low incomes, families with children and inactive people. And we measure that through social network analysis, but also there's a national active lives survey which Sport England administer each year. That's showing us over time there's an incremental change, but we also have local data that we use. So the pupil lifestyle survey is undertaken each year within schools around children and young people. And we also have a local face-to-face survey that we fund and we administer across 8 of our communities. So we did the first one in 2018. We've recently revisited it in 2024, and each year we'll be undertaking that over the next 3 years to understand behaviour change in those communities we're working with.
That's great, thank you. You've already answered part of my next question within that as well, so that's absolutely great. How about thinking about sort of young adults that suffer with mental health problems, sort of teenagers probably up to the age of 19, 20 years old? You know, how do you help them, or what help's available for those?
Yeah, it's a relevant one, because when I was preparing for this report, I was looking at some of our figures and what we're reporting. So your question about how do we measure it, we've measured it pre-2018. However, the world does change, doesn't it? So I was thinking, I thought, well, we started in 2018. What's here now? That's a big pressure on that. That wasn't there. And TikTok only became a UK-based company in 2018. But we talk about the pressure it gives young people all the time now, don't we? Social media. So if you think in that very small amount of time how the world has dynamically shifted for young people. So what would we do is we use a lot of engagement with young people and organisations. So if I go back to the play shelters, the teenage shelters, we engaged with over 1,000 young people over a period of time in different means, which gave us some rich evidence around that. When we talk about them on a more local level, local people know what is a local needs, and young people know what helps them. So the way we work, as Jodie said, is particularly through the small grants, because what we've realised is, of testing it through other things, is a small amount of money actually can go a big way, where a larger amount of money tends to be used by those statutory organisations that work on a larger footprint and don't have that granular knowledge. So working with young people, etc., we're designing programmes and activities that work with them. The schools work is a key one, which Dean in our team does, enabling them to actually embed physical activity. And the work that we'll do with R-Dash around talking therapies, although primarily adult-focused, will bridge that gap between sort of the teenage years and adulthood as well to help them there. So we're trying to layer things which enables across a whole span. We're not the answer to some of this, but we're then able to help with some of this. And that's key to it. We can't directly enact on it, but we help across it.
That's great. Thank you very much for that.
That leads me on to the next question, which is mine. With I know Doncaster's got many assets for improving and maintaining physical activity. With your green flags park, with your walking, wheeling, cycling, infrastructure, and the ongoing commitment, how GDM network partners to continue to contribute to reducing physical activity and improving health outcomes. Also making Doncaster a place where well-being and physical activity are part of residents' daily lives. Firstly, can I just ask you what wheeling is?
Thanks, Chair. I can answer that one. What we needed to do was make walking and cycling more encompassing to cover the broad range of people that need to access the services. So if we think about wheeling as people maybe using wheelchairs, they might be self-propelled or being pushed or pushing themselves, but it's sort of anything that goes at the same pace as a pedestrian, really. And obviously, because we want to include everybody, we wanted to make sure the way that we described it included everybody. So hopefully that makes sense to people.
Thank you. What are the steps for inactive residents with health issues already that restrict them from physical activity? I think you've just filled that one in for me.
If you'd like, I can give you a bit of an example of a project that we're doing currently that would target specific groups of people. So this is a pilot project and it's called Ride, Stride and Thrive. We were fortunate enough as one of only 11 local authorities across the country to receive funding from Active Travel England to develop a pilot. And the pilot targets people with long-term conditions and disabilities specifically. And what we know is that sometimes people need a bit more support, a bit more encouragement. They need their confidence building to do that. So we offer a range of activities in 3 locations, which are Woodfield Park, Bentley Park and Sandal Park. And it's all focused around walking and wheeling and cycling. So we've got adapted cycles for people that might not use a traditional type of cycle. We've got people that want to walk but are not very confident in walking. They might not like group settings, so we can do that as one-to-ones rather than just in groups. But the underlying thing of it is that the people need that support. So rather than be overwhelmed by going to one of our other walking groups maybe that's on offer for people that are a bit more confident, they've got that one-to-one support. So the people that work with them, they contact them, they make sure they're all right, they check in on them, they make sure that they're going to come to the sessions, and it just gives those people that additional support and confidence that actually, yeah, this is for me. For people that are not, maybe as capable at walking as some other people, we've got walking poles to help if they want to do that. So we've got that broad range of activity. So that is being evaluated as well. So you'll have heard us talk already about us evaluating things and wanting to know how things are working. So we've got a provider that's doing our evaluation for that, and we feed that back into Active Travel England, and they'll be doing a full evaluation of the whole pilot across the country to see what benefits that's brought to people and how it's helped to people. So it's very much a qualitative based approach. So it's rather than numbers, it's about that quality and what people are getting out of it and what it means to them in their lives and how it's impacted positively on them. So that's just an example, if that's okay.
Thank you, Caroline. Yeah.
This fitted in with the disability theme. One of the major barriers for disabled people with long-term health conditions, getting out and attending like classes or whatever, is actually community transport. That is a huge barrier. It just doesn't work properly. SIMCA is, this is a bit of a statement, but SIMCA is undertaking a review and a consultation. You talked about, all the partners and influencing people. That is a very, very large issue for people. And so if you've got sort of any influence over community transport and feeding into that review, that would be fantastic.
Yeah. I'll take this as a transportation rep. So yeah, we are aware of that process and we are feeding that in. And I think we do get comments from when we're engaging and talking to local people about the expense of community transport and how much it does cost the individual, and we're making Simca well aware of our opinions and thoughts and need to improve that service for the residents.
You can only get out to something if it's between 10 and 2 and that sort of thing. I just have one other question about motivation. Obviously, motivation is absolutely huge, is needed to get people active. And you sort of mentioned that people were aware that exercise was good for them. Do you think people are aware how good it is for them, and the fact that you only have to increase your activity levels relatively small amount to have a massive effect? Do you think people really appreciate that, or think, you know?
In the face-to-face research we've done, it was overwhelmingly strong. The message back was, we are very aware, you know, residents almost said, as part of the research, stop telling us it's good for us, because actually that will put us off. What really came out as strong as making the biggest difference is providing or enabling support for people to plan it into the daily and weekly routines. So I was actually listening to a podcast this morning, but it underpins a lot of the theory of our work, is there's a gap between intention to action. So we've all made those promises in our head, whether it's about getting out for a walk more or, you know, drinking less, smoking, whatever. We've all made those things about commitments in our head to stop or start something. But then there's a gap between then doing it. But what the theory says is if we make small changes into our routines once or twice a week, that starts to build a regular habit. So if we can provide support to people to make those small changes and build it into their plans, basically, throughout the day and the week, that's going to make the most difference to motivation and behaviours.
Can just follow on from that one. One of the things we've done is we're talking here about inactive residents with health issues. So one of their key points of reference is GP surgeries with health practitioners. And what we've found out is health practitioners, GPs or practice nurses, etc., don't feel skilled to be able to have that discussion around you should be taking part in physical activity. If you've got mental health issues, it's a good way of reducing mental health issues. So what we've recently done is trained 300 GPs and health practitioners across Doncaster in the national moving medicine tools. So they're able to work with those people when they come into the GP practices, when they have those appointments, and actually have a discussion around physical activity, which, as Jodie just highlighted, is then make them actually think about the steps that they can take to actually make it normalise it for them, rather than it's something they can't do because they have a health issue. Well, hopefully we'll start to see over the next year or so that in fruition with some of the other programmes we're running.
Thank you. Just popping back to the ride and stride for a moment. Am I able to get more information on that? I actually work within this sector myself, and
Definitely, I can get you some information sent over if you'd like.
If you could, that'd
be
be
if anybody
fantastic.
else wants to know more about it, we can. Yeah, I'll send it via Caroline and she'll share it. Is
Great
that
stuff,
okay?
thank you. Yeah, and is this open to everybody? The pilot as it is at the moment.
It is really, yeah, but it's only at those 3 locations. So unfortunately, and sort of linking into what you were saying a bit, Jane, but the idea of it is we want people to feel confident to go out in their own community mainly. It's not about like long distance travelling, it's about enabling people to benefit from what's in their community. And that might be services, shops, it might be accessing parks, you know, visiting a neighbour for a coffee, that kind of a thing. So it's very much on those very short journeys that we're talking about. We're not expecting people to start running marathons and, you know, cycling 20 miles to get somewhere. It's very much about what can they do within their lives that'll just give them that small benefit of activity, and links into what Jodie's saying about just building it into your everyday life. But yeah, definitely we'll share that information.
Brilliant, thank you. And then over to Gerald. Gerald has a question, Councillor.
Right. I took a few notes from your introduction to health. It's great that Asking Leisure Centre did get a rebuild, and it's great. But the thing that I was looking at is what Dave just said. Transport getting there. We've got elderly. What now are isolated, basically, cutbacks. So they can't get to leisure centres. There's nothing there for them to do. We're talking about the the health. They used to like to walk, get on bus, come into town, do the walking. So the cost of transport now, they can't get in. So how can we get them moving when they can't get out? That was one of my questions. The other one, with the young, you mentioned tennis courts and things like that. We used to have tennis courts, but because of finances, again, it comes down to money. The tennis courts were dug up and houses were put on there. So that took away that. We also had a nice bowling green in Asken. Again, it was dug up, houses put on there. So it took away a lot of physical activity for elderly. It seems that when we have things in place for physical activity, it doesn't remain there long. In fact, we've got a case going through now in planning where they're looking at where children are using the sports field, and they've used it for a long time. They're going to dig it up and put houses there. So when we come about health, I think that doesn't appear to me as taken into account when it comes to building. So the building takes priority over it. So I was going. This is where I was going to go with the mental health. Do you find that? Because in my area with young children, because all this is taken away, they've nothing to do, and that can doesn't help them with the mental health. They've nothing to do, and this needs addressing because we're taking away the things. What you're saying, physical activity, like I say, with the parks, the sports fields, they're all being taken away. So we're reducing the things for physical activity, and when we've got elderly that used to have physical activity, like I said, catching a bus, getting into town, meeting friends, walking around the French Gate Centre, it's all been taken away on the grounds of money. There's no money there, and when you try to, and I think I spoke to you the other day about it. I've got 2 elderly estates down where I live, and now they can't get out of house. They can't walk. They can't, the pavements aren't fit to walk on. They have to meet a certain criteria, so they can't even get out. I've got a partially sighted woman, used to get out walking. She tripped over on the state of the pavement. I asked about it, no money for it. She's now isolated herself in house. It comes down to money. When you talk about adult children and things like that, they're not accessible, and when they were accessible, houses came into the structure, and it was all removed. Now, if somebody and I do appreciate, I've seen your work down in Asken. It's great what I've seen with the physical side. Does that go through? Because if it's in Asken and I've got somebody in Norton, we don't have that. So if anybody in Norton, I'm saying the elderly, there's no place for them to have access to all that. As I say, it comes back down to transport. So when we talk about getting people moving, it's been taken away. It's been taken away. You can't even get to doctors without having to pay money out of the pensions to get there. You know, so I'm finding we are actually taking the physical activity away from them. Would you agree with me on that?
So there's a lot in there, Councillor Squire, and I think probably most people sitting this side of the desk will be able to address some elements of that. So I'll bring Caroline in a moment about what's our public health approach around planning and spatial planning. So we do have a voice and we do have a mechanism within that. And then Andy perhaps will come in around what is available in Asken. But as he said at the beginning, we're still midway through this story and we'll have that established network as well. And we've got people within that network that are more than happy to work with passionate people in communities to look at other physical activity opportunities within those assets that are there. So if I just bring in Caroline first about planning and then Andy.
Yeah. So obviously any application that comes in to build houses goes through planning, and planning generally planning committee if they're of a certain size. What we do in public health is something called a health impact assessment, and it asks lots of different questions about how that development will impact on that local community. And what those mitigating measures might be. So it's difficult to go back historically on some of them because some of those might have been prior to us using this process. But what we'd expect then is the developer to come back and say, right, we're using this for X, Y and Z houses, blah, blah, blah. We're giving up a bowling green or whatever it might be that's been taken away. But ideally, through the planning committee process, there should be some mechanism for that to be replaced somewhere else, or for Section 106 monies or something like that to be given to the community to create something that's similar, not necessarily the same, but for the people to use in that area. So there are processes that enable that to happen. But it's a massive conversation and probably too big for today when we're starting to bring in around planning policies and planning regulations around how places get built. We know we've got a housing shortage. The government have issued bigger targets around creating more houses across the UK, not just for Doncaster. So it's a difficult balance of what space we've got. Some space is specifically allocated as green space and shouldn't be built on unless there is a really solid reason that that should happen. But again, it's complex and it's all policy driven, but we do look at it and we do try and influence that decision making as best as we can, not just around green space, in lots of other things as well in the area that maybe don't promote the healthy town or village that we'd like to do for Doncaster residents.
Can I come back to you on that, Caroline? Because you mentioned when builders get the land and they start building in Section 106, that can take from starting development, closing it off, to actually finishing the development, it can take years. What do they do in that meantime? And Section 106, they don't always direct it at the areas that it should be directed at. And and like you say, it is a complex thing with the building regulations and that. And when you look at the healthcare system, I don't think there's not a lot of it taken into account when planning look at buildings. Like you said, there's a shortage of houses. I think public healthcare, it's not one of the top priorities. We suffer, and I spoke to you a bit ago about surgery. How surgeries are overwhelmed. They can't. People can't get in there. So my take on that is build. Healthcare is one of the last priorities when it comes down to infrastructure in villages. It's the last thing they think about. Digging up a tennis court, digging up a bowling green, although it impacts the elderly because they like to use the bowling green. The kids used to like the tennis. When a site is earmarked for development, nobody turns around and says, well, them kids won't get to that tennis court. There'll be non-tennis court there. The elderly that used to like going out and doing bowling, that's gone as well. Nothing is, when these things are taken away, nothing is put back in place. And just one thing, I know I'm adding it, grants. I didn't even know we could get access to grants. Well, you know, I've just come on this panel, but after you've gone through this, if somebody can give me some idea how to get a grant, it'd be much appreciated. But there is a lot that I've
Councillor Squire, if I may, so we can absolutely help you with that. And I'm just really conscious that we want to focus on the topics of the Health and Adult Scrutiny Committee and the work that we've prepared today, and don't want to step on the toes of planning committees as well. So it might be as a work planning conversation. There are health aspects to this that we're more than happy to pick up with you either through a health scrutiny process or separately, so we can provide more information about the public health input that we have around planning. I do just want, if it's okay, Chair, if we just give Andy the chance to provide some information now around how grants can be used in communities, and then I'll come back to you, Chair.
Thank you. So, yeah, I can see your frustrations there. It's a system that's designed to do a certain thing without understanding the unintended consequences. And that is part of our work, is to actually help the system see that. Caroline's working really hard to do that. So, and a lot of these decisions are made well before we started this work, you know, the historical, so we're working within that. The grants one, great you asked that question, really, because one of the things I said at the start of this, I want you to be our champions, our advocates. So us being here is hopefully helping you actually realise there's things we can offer you that you can work with your community. So we will be launching the grants process that we have in January. We've done about 100, I've got my notes here, about 158 since 2020. The amount of money we've got lined up to go through to 28 could potentially run anything up to another 200 grants of up to £500. Okay, so those small grants through a process that Doncaster and their community teams lead on our behalf. So we'll definitely connect you with that and any other infrastructure or revenue grants that are coming down the line that we can support you with, definitely.
Thank you for that. I'd like to move on to Councillor.
Thank you. Yeah, just popping back very, very quickly to this assisted equipment. I think it's absolutely fantastic. I lived in China for quite a long time, and I know how popular it is in places like that, and I know what benefit it can bring. Is there any plans to expand that into other areas?
What we are doing is pivoting our leisure trust to a health and wellbeing service. Okay, I can talk to you a lot about that, but each of our sites, we will use the evidence in each of our sites as we refurbish them, what is the requirements for that community. So, for instance, in Rosington, we've got a traditional gym that we've just put into the facility there. As we progress at Thorn, we've both got traditional gym and the assisted gym, but we are focusing in Thorn because there is a high proportion of people with disabilities in Thorn than anywhere else. Not the largest population size, but per head of population percentage-wise the largest. That site will look at people with working disabilities, so that's where the equipment will focus. And then as we progress with Edlington will have a pool and a wellbeing suite because we know there are the health issues and the need for that in Edlington.
Oh, perfect, thank you very much.
Right, going to page 21. Looking at boosting of the local economy through jobs and businesses in sport and physical activity, ensuring every school becomes active with the infrastructure for active travel to promote and enable walking, wheeling, cycling for daily journeys. Although cycling and walking are okay in the summer, it's great to be out in the sun. Is there any programmes for the winter months, like the autumn, winter?
Thank you. So we do know that some activities are seasonal. We do know that self-organised activities like taking yourself out for a walk, playing with your kids or your grandkids, etc., outdoors does peak in the summer. A lot does still happen in the winter though, and colleagues will come in, particularly around walking and cycling in a moment, but this comes back to a lot of the research we've done about behaviours and people taking part, and residents have told us they are still generally active in the winter, and much of this comes down to the work we do to build what we call resilient habits. So if people get used to building it into their daily routines, they're more likely to sustain it or even change or adapt their behaviours in the winter months. So, for example, a lot of women talk about in the summer they might go out for a walk or a run in the evening because it's a lot lighter. But then in the winter months, many work with flexible sort of working hours, so we're able to do, change the working hours to do it during the daylight hours, taking longer lunch times, etc. So there are small adaptations that workplaces can make, within the way that they support the workforce to support people to adapt throughout the winter. But I'd like to sort of invite Caroline and Kerry to talk a bit more about the walking and cycling element that you picked up on.
Yeah, so what we know is that lots of people do still walk, wheel and cycle in the autumn and winter months. One of the reasons for that is because it is a low-cost form of transport. And also 1 in 3 residents don't have access to a private car or van, so in many circumstances it is their only option of getting around about, whether it's going on the bus or walking, wheeling and cycling. So that's why making investment, as we have been doing over a number of years, in the infrastructure is really, really important to ensure that routes are accessible at all times of year and people can use them. So we've delivered several schemes which have addressed this. So particularly on popular off-road routes as well, such as the Trans-Pennine Trail. So we completed a scheme last year between York Road and Melton Road, which amongst lots of other things such as widening the path, improving the directional signing, adding in benches, we applied a sealed surface. So what we found out from talking to the community is that for most of the autumn and winter months, when it rained heavily, that path was inaccessible because of the surface. It was muddy. You couldn't go out and walk your dog. You couldn't cycle down there. You couldn't go out for a family walk because it was just inaccessible for a lot of the year. So we applied this sealed surface, and one of my favourite comments that came back from the scheme, and one of my favourite case studies is that when it was completed, there's an older resident that actually lives overlooking the trail. He's wheelchair bound, but because of the surfacing and because of the weather conditions and the muddiness, he couldn't use it. But now we've put that sealed surface on, him and his wife actually use that asset most days, and that's really kind of letting him get out in green space and really kind of enjoy that activity. In terms of other programmes that we do, they all run all year round, so they're funded via grant, usually via SIMCA or Active Travel England. So SIMCA is the South Yorkshire Mayoral Combined Authority. So we run free adult and family cycle training at 3 venues around Doncaster, so Sandal Park, Woodfield Park and Bentley Park. This runs throughout the year, including autumn and winter. And what we've found from running this service for a number of years is it does continue to be well attended, even in the winter months. People still do attend that. And so far this financial year, we've actually trained 660 people to learn to ride a bike, which is a really good start from April. We've also got the Active Travel Hub, which is based at Doncaster train station. So this is a place where you can go in and hire a bike free of charge, loan a bike free of charge. You can also get travel planning services, and they offer weekly led rides and walks, which again run all year round. So again, this service has been really successful this financial year. We've loaned over 280 bikes. We've done 274 personalised travel plans, which is basically saying if someone says, right, I need to get to the GP surgery, or this is where I work, I'm wanting to do this by walking or cycling, they'll provide the safest and most convenient route for people to do that. There's been 17 led rides that have also been attended. And as Caroline mentioned earlier, the Ride, Stride and Thrive programme also runs all year round as well.
Again, I'm
Thank
sorry.
you.
That's
Just one second. Councillor Pritchard has a question.
Hello. It's regarding outside activities. Have you noticed there's a difference with people's safety during the dark hours? What is the difference? Or are you keeping it monitored regards running and walking? And how can we maximise people's safety?
Yeah, so Andy will give us a bit of an overview of how people feel safe and what threats or risks might be to people's safety. And then Kerry, I think, will talk about some of our approaches.
I'm Councillor Pritchard. I'm smiling this one because myself and Maria had a long conversation about this when we had a discussion a week ago. It's the perception of safety we need to consider, not what is safety. So a lot of people talk about, let's take parks for instance, a lot of people talk about parks being not safe places, actually. Parks are very safe places. Statistically, they are. What we tend to hear and what we hear constantly in the press and by other means is the things that happen that are not good. Okay. So I won't mention the area, but there is a green space in Doncaster that we worked heavily in over the past 3 years, that when we first started working in there, you don't go there because probably now 20 years ago, there was a significant incident there between two individuals, which the community were quite rightly shocked about. It wasn't the green space, that was bad. It was the individual who perpetrated that. So perceptions of safety is key to this discussion. Yes, there are times when places aren't safe and people get harmed, etc., or things happen, and we have to recognise that. But ultimately, places tend to be safer than what people think. And actually, what the key aspect to do that is take green spaces, or as we say, we've just been talking about people changing habits in the winter. I'll give you an example. My wife and her walking group on our street, that we live in Wheatley Hills, they normally go walking in Sandleby. What they do in the winter is they just walk around lit streets, okay, as a group. So as a group, they feel safe, and that's the key to it. If we have people in spaces, people will feel safe. The evidence tells us that. That's what our work in the parks is. Not necessarily to put more football pitches in there or tennis courts, etc., but it's to get more people in those spaces so people feel safe and use them. And then when we do put facilities in them, they get used. Okay. So I think part of this is we need to flip the narrative of the discussion. Are places safe? To they are, but what's the perception of it, and how do we battle that with the evidence we've got and the narrative and the stories we can tell? That makes people actually suddenly realise, oh, hang on a minute, it's probably not as bad as we think it is, and therefore we will use that space, and that's what we have to work hard at.
And probably one of the bigger risks to safety is probably roads. So, Kerry, if you're right to talk about how to make roads safer.
I think to understand what measures have made a difference, we've kind of reformed our community engagement and consultation process to really listen to the residents and the communities about and to address their perceptions of safety. I think kind of looking at it from, you know, a child crossing a road at a certain location or someone with a mobility aid will feel more vulnerable to the road at certain points. So it's really important that we get that local community knowledge and use the funding that we get via grant funding through Simca to invest in the right places that's going to make a difference to enable people to walk, wheel and cycle around their community feeling safe. I think in terms of the improvements and what we're doing, obviously it's increasing and upgrading street lighting. People being seen and having that brighter lighting do tend to feel safer. I think improving the surface quality on paths as well to make sure that there's less of a risk of slip, strips and falls, and that it's a more even surfacing. And like I said, upgrading those crossing points and ensuring that they are appropriate for the level of use, and the location and the speed of the road is really key. And also improving and installing more tactile paving to aid visually impaired people. I think this all comes together in terms of when we're delivering a scheme. It's a lot about placemaking rather just a scheme. We're going into a community or an area to try and improve it and to bring all these factors in to enable people to feel safer walking, wheeling and cycling in their communities.
Thank you for that. I've got another question from Councillor Carroll.
Thank you. Just with regards to increases and decreases in the levels of activity, how is it measured?
So we've got a couple of examples. So there's some limitations around what's routinely collected at a national level. So they do measure levels of physical activity and inactivity in adults overall and children overall, but it generally uses survey-based information. So you can't ask everybody in Doncaster, have you done your physical activity this week? So there are limitations, but we do a lot locally, and colleagues will explain, a lot locally around the evaluation of systems and things that we put in place. And as well, we're able to see how some of our assets like DCLT are used. So there's probably all of us that can answer a bit of this. So I'll start with Andy.
Thank you. When you arrived today, I gave you sort of a pack of things that we produce, booklets, etc. They're all pieces of work. But what I would say about around this, if we have an impact report, which is that document, and when you have time, I would recommend you just have a look through it. And the pages 8, 9 there are particularly around that data. What we do know is not one data set tells us the story. So we have multiple of data sets or evidence that we pull together. So we can have that. We have Active Lives, which is a national survey, but it's not particularly focused on a specific ward. It's just a very snapshot of the whole borough. We have Moving Communities, which is one around leisure trusts and leisure industry. Jodie's already mentioned the local surveys that we undertake, etc. And we have a host of economic, educational data, etc., that we look at and we pull that together. that gives us a sense there. What we look for in there is changes over time. Okay, so most people go, oh, what have you done from last year to this year in this work? You don't measure it like that. What you need to look is the trajectory right. Is it heading to a positive position? Because in some years you'll get a negative, and then in others you'll get a sudden growth. Why that happened? What you need is what is the line between all those? And what we are seeing in Doncaster is the data's telling us we are decreasing inactivity. So more people who are inactive are becoming active, and we are actually seeing an increase in those people that are active to be more active. A lot of work to do. And there's a lot of ifs and buts around that. So we're seeing things like people who are active in our local surveys. The question is, are they being active enough? They think they are, but are they being active enough to impact on their health? We talk about other measures there. So the Leisure Trust, etc. We have a social return on investment. So our investment into Leisure Trust. So each year we're putting capital into those buildings, and we're also giving them a subsidy. It is, I'll be very honest, it's a very cheap trust to run. The amount of money we put in it compared to what's nationally. But we now know we can measure what is the return on it. So last year when we measured it, social return tells us on things like what's the benefit to people who've got cardiac disease, what's the benefit to mental health, and if we had to pay for service to do that, what is the value of the Leisure Trust to do it? Last year's value was 60 for the 12 million that went through the books. So that's our subsidy of about 1.25 million to 2 million last year, plus all the other money that goes through there from people paying. The return for the community of Doncaster is 66 million in value across a whole host of things. And we can measure that by each centre. Okay. There's more centres have opened up their facilities as we refurbished them this year. We're looking at an increase of that of up to about £88 million. So if we had to pay for those services, it's 88 million. What we're now doing is that same measure with Club Doncaster and what their community offer looks like and what the Club Doncaster community offer does, because they've got a wide reach. And we'll look at what their social return on investment is. So it's not direct cash, most of this, but it's the benefit of those services being provided to our communities.
And then just to add some extra bits, so Jodie might describe as well the kind of stories that we hear, including through the network. So, and it's worth the share of the link, Andy and Jodie, that includes the Dance On programme. So you hear people that participate, so generally older people participating in the Dance On programme, and talk about how that's changed their lives. So as well as improving their physical activity, giving them a purpose to get out and about on that day and build new relationships. So I'll just skip Jodie quickly, and then Kerry, if you want to talk about when we said about local authorities having the opportunity to build places, so what difference it makes when we make a difference to the infrastructure. So Jodie.
Thank you. Yes, so through our network meetings, particularly the 4 we have each year, we get partners from across the network telling us stories about the impact they've been able to have individually as organisations, but how they've worked together. So Darts, who deliver a number of fantastic programmes out in our communities, deliver Dance On, which is in 5 community settings for adults over 55. You don't have to have any previous experience of dance, but they particularly target or support beginners. And there are loads of fabulous stories about people who have been able to have significant improvements to their health and their mobility, even in just a short few weeks of taking part, through to making new friends and connections. So people who are isolated and lonely, not getting out of the house much because they didn't have friends and family to connect with, made those connections through those sessions. And then as a result of Darts doing that work, they've been able to help connect with the health and care sector and then broaden their offer into new communities through different activities and programmes. Just the other week, we had a new partner organisation join the network for the first time, and I think they're known locally as Mental Health FC, and they're a relatively new organisation, and they target particularly men through football, supporting them with their mental health. And it's really powerful because the colleague who leads that has been through a journey himself of mental health struggles, and the work they do, particularly with young men, has shown fantastic impact over recent years. And through the network, the leader of that organisation, again, is connecting with other organisations to partner and grow their offer in new communities, to invest, to get new investment, etc., and to impact more people and residents across the borough.
Yeah, so I think in terms of investing in using the active travel funding to invest in placemaking, what we're seeing is more people actually want to be in their local community. What we did with that programme is working across our Get Doncaster Moving system. It is looked at places where there was high levels of physical inactivity and there were areas of high deprivation, and we targeted those communities to try and get that uplift and really focusing on kind of shorter journeys, connecting up people to places. So whether that's to local schools or higher educational facilities or to the local centres, the shops, the GPs, the libraries, to really kind of focus on creating that place where people want to be and feel a sense of pride in their community, because, you know, the roads are resurfaced, there's new street lighting, we've greened it up and we've put sustainable urban drainage in, and we've made safer routes and safer crossing points. So pedestrians feel that they belong in that environment now.
Thank you for that. Councillor Carroll's got a question.
Just to follow up on the increased activity. So really, we don't know that the data's accurate, do we? Because every area within Doncaster, you know, sort of whether it's Conisbrough, Mexborough, Lakeside, every area is different. And really, we outside of the Leisure Trust, DCLT, and the measurements that we can get from them, from people swiping their cards in and out, and people that you speak to, really, we have no idea what anybody else is doing. You don't know how many times a week I walk around the lake or I play squash or anything else, really.
And I don't think we'd be particularly interested in that. That's your information house. So what our duty and what our responsibility is to reduce the levels of physical inactivity for all Doncaster people, but particularly those target groups. And the work that we do builds the infrastructure, makes the connections to be able to do that. The question about how accurate the data is, so the active lifestyle surveys that Andy described, we have reported the numbers in this report. And they have shown an increase in the number of people who are physically active regularly. So we can be as confident as we can be in that kind of data, acknowledging the limitations of its sample size. People are truthful when they answer the questions. There will be other provisions, thinking of the holiday and food programme, many of those physical activity related, and they will collect who's been and who's come along. But actually, I don't know, Andy, correct me if I'm wrong, we're not interested on a person-by-person basis about the physical activity levels, but we want to know that people are being active and engaged in the communities that they're in and benefiting from all the different aspects to that. And the picture that we've described there, we know that patchworks of the stories that we hear, and being able to see more people walking on the streets, and the park areas feeling safer because more people are there, that gives me a lot more confidence that people are having more opportunities and taking those opportunities to be physically active in Doncaster.
That's fine, thank you.
Right, we've got a question from Councillor Guest.
Yes, thank you, Chair. And thank you, Andy, for that presentation. I think it was interesting. I might even say you've inspired me a little, but only time will tell with that. So my question's about leisure maps and walking maps, etc. So it's on a practical level. If I go for a walk, I tend to head to Lakeside and do a circuit or two. But if I wanted to differ from this, where could I find walking and cycling maps particularly around rural areas? And my question's in two parts. How accessible are they? Downloadable and paper copies if possible, if like elderly people can get them, people are not as IT savvy. And are they promoted and publicised enough? And the second part of my question for officers is, could officers outline the cycling path improvements that have been throughout Doncaster that have come from outside of the CDC's budget? So there's two parts, cycle maps and walking maps, and then cycle maps improvements.
I'll start with walking maps, Councillor Guest, if that's all right. So we have had on the council website for many years access to various types of walking maps for people. What we've realised while we've been going through this transition and working out this broader GDM scale is that we need to make those more accessible to people. So what we are currently doing, we've got we've commissioned a programme that enables us to create some online maps for people, and what we're able to do with those is create different types of maps, so targeting different audiences. So it might be targeting a school, or it might be targeting something in a local community. Lots of different templates that we've got to do that. Now we are in the process of developing those, and I have got a paper template that I've brought with me just so you can see that they're very straightforward. You probably can't see it from there. There's a bit of a description. This is a Stainforth example. The short walks, this one that I'm just showing you now, but it's got a bit of information there around what's happening, the route description, so people know what it's about, but then on the back as well, like a little map that hopefully if you're living in that area, you'll recognise some of that. I can send these, Caroline, as templates to attach just so people can have. These are not the finished article. We're in the process now of just getting them sorted. But what we hope to do is, yes, they will be available online, but then through our connections that we've got in communities and with other organisations, they'll be able to get printed off at those places if somebody needs a paper copy, so they will be created in a way that they can be printed off. So hopefully that answers some of that question, if that's okay.
And then, Kerry, are you all right just to talk about the origin of active transport?
Yeah, I'll just come in quickly on cycle map. So we've got a hard copy of the cycle map, folds out into a big plan that covers the whole of the borough, including rural areas. They should be in most local libraries. They're at the Tourist Information Centre, and there's a contact where you can email in to our team, and we can post one out to you. But if you would like a box of those to distribute in your local community, drop me a message and we can facilitate that. So in terms of the infrastructure, so what we've invested in isn't just a cycle pass. When we've done schemes, it's been looking at the whole placemaking, as I alluded to earlier. So what we've tried to do is take it from the highway boundary from side to side and look at the whole streetscape to create that improved place. All the funding and all the things that we have delivered has come solely from grant funding. So that's usually via the South Yorkshire Mayoral Combined Authority, which has usually been devolved from either the Department for Transport or Active Travel England. In terms of what we've invested in, so over the last 5 years, we've been focusing on the Transforming Cities programme, which was £24 million worth of investment. Again, delivering what I alluded to earlier, at the start of this programme, we worked with GDM colleagues to look at where we've got the biggest issues and where we can really make a difference in terms of people's health and improving physical activity with this funding. So in terms of that £24 million, around £4 million of that has gone on creating cycle lanes. Around £4 million of that has gone on improving footways. Around £2 million on improving lighting. So this is across various locations across the borough. Around £5 million has gone on road resurfacing. So again, trying to make sure that we're benefiting the place and doing the most with this money. We've invested on South Parade. We've invested in Bentley, Adwick, Conisborough, in Thorn, on Ledgerway, on Thorn Road, coming past the hospital, and in Balby. There's a whole host of other schemes that we've kind of delivered. I'm happy to go through them. I'll send out further detail on what we've done and where we've done it, but I think I'd probably bore the committee if I get started talking on this, and you'd probably be here for the rest of the day.
Thank you. Right. What improvement do you feel has there been in people's health overall?
So just looping back to my introduction, so I think when we described about how the scrutiny panel wanted to hear about cardiovascular health, and we said, oh, we'll bring to you Get Doncaster Moving and physical activity as one of the real kind of biggest bang for buck about population-based health improvement. But it gives me a chance as well to talk about our stop smoking services that we have in Doncaster. Again, another risk factor for cardiovascular disease, support for people who want to reduce their alcohol intake, and other healthy lifestyles, so access to healthy food as well. So physical activity is one of those. I said at the beginning that Doncaster has a lower than England average healthy life expectancy, and that would be expected in a place like Doncaster, thinking about the population makeup, thinking about the history, the mining communities as well. But it doesn't mean that we shouldn't do things that help to improve health on a population level. This isn't the only thing we do. We do a whole heap of things. And if we're work planning for the future, we'd love to talk to you about women's health. You'll hear in January about health protection and screening, cancer screening we do as part of that. We can't do one single big bang thing that's going to improve people's health and well-being overnight. Public health is an investment over time and over generations. But we know that improving opportunities for physical activity for all people in Doncaster will improve health and well-being, and baking those habits in the early days as well in people's in people's childhood, so they're able to keep on with those physical activity habits through their lives. Thanks, Chair.
Thank you. Councillor Squire has another question.
I was going back to what Nick had said, and he said it's gone. Can I still ask the question, or? Yeah. Going back to he mentioned about when it gets dark, running, walking, safety, and my question would have been is the green spaces that we have, the parks, out where I live. We have a lovely park. It got the green flag, but after 3:30, can't be used. No lighting. When you go on, that's why we're going to go on about safety. If you wanted to go up to Lakeside, it's lit up like it's a summer's day. These rural areas, to access the parks, they can't after a certain time. So, and walking and cycling up where I live isn't really a good idea. The road's narrow, the paths aren't wide enough. But coming back to this, what measures can we put into parks, and especially in Autumn Park, the Campsall Park, lovely park, summer, but after 3:30, you couldn't use it because they put the paths in for walking and everything, as I say, during the day. But coming back to it on an evening, nobody'd feel safe.
So I'll hand to Andy, but Councillor Pritchard, I know, was present at our Health and Wellbeing Board recently, where Ben gave an overview of our Future Parks programme as well and what's happening there. There will be some places and spaces that are for daylight use, and there will be alternatives for people to use when it's darker as well. So it's probably not the right thing that every park area has got lighting available to it, but I'll just hand over to Andy.
Excuse me. So, Campsall Park, it's had significant investment into it. So we spoke about the nearly £1 million of sporting the money, and then we've had an additional 350,000 of sporting the money into the park directly. So that whole remit was to enable an active environment. What we have to realise is seasonal use is a bit like a life course in our life. In our life, we're active when we're children. We then get families and work, and that may stop us being active. Then we get spare time when our children leave, and we may be active again. A year is just a life course of activity. We can't, nor should we, want to light all our parks, because it's not guaranteed that's going to get people to use them, particularly rural parks. Campsall Park is a specific park. It's a rural park that is left for perpetuity because of what that is. It's not the same as Lakeside. Lakeside is a footprint around a housing estate, essentially, with a lake, isn't it? But people do use it to active travel. And one of the things we are doing, and we're working with internally, is we're starting to develop an active green environment policy for the council, which means as developers develop new sites, they have to look at how those active environments are built into it, and that policy will enable. So when we go back to your original question, some of those decisions were made a long time ago before we started this work. We realised that, and what we're trying to do is put policies and procedures in place that we don't make the same mistakes going forward. Okay. And there weren't mistakes made at that time. It's just like the policy told us to do that. Sorry, just on Campsall Park, we couldn't light it. One, the infrastructure isn't there to do it. To put the infrastructure in would cost millions to do that, and then the cost of running it. So it goes back to your original comment about money. Do we spend that amount of money in that part to enable what might be a few hundred people on an evening use it, where we could have spent that money in the leisure centre, as we did. So that's the balance and decisions we have to make. In a perfect world, we'd have the money to do everything and enable to do everything and make it safe, but we haven't. So we have to make some hard decisions, but at the same time, we have to balance that against what's the evidence telling us as well.
Yeah, so my undertaking of that then, it's a seasonal park. It's great during summer, but you can't use it during winter.
This goes back to perceptions of safety. So people choose not to use it during the winter. So that's the question. But that's a natural thing what people do. Actually, the number of incidents in that park, we can go and look on the logs and see how many incidents in the park. And I would probably hazard a guess that it's quite low compared to, say, like Townfield. But Townfield has lighting around it, and people cross it on an evening. So it's a perception of safety and usage. So if I was a group wanting to do a back walk, which we have done, we can get 30, 40 people come on a back walk and quite easily walk right through Campsall Park, which they have done in the past in the night. If we wanted to do a Halloween walk, I'm pretty sure if we did a Halloween walk in October when it's dark, we'd have a large group of people coming to do it. So it's the perception of safety, and it's what are people using it for. So a recreational walk on my own, I'll be honest, I worked in the outdoors for 20 odd years, and I'd do it, but I would feel a little bit nervous and think about it. My wife wouldn't do it. I would never convince her to do it. So we have to understand behaviours of people as well. It's not a part that's not used in the night. It's that people actually have a perception of safety. It's the behaviours of those people, quite rightly, make the decision not to use it.
Yeah, my point is, I actually go around that park during the day. I do, because I had a similar thing to what you had. But my belief there is you get a lot of dog walkers, you get a lot of ladies walking there through the day with the dogs and everything. But as I come to, like, going back to Councillor Pritchard, they wouldn't use that after 3:30, whereas a lot of people finish work, don't they? They finish work at 3:34. They can't go out and take their dogs onto that park because it wouldn't be safe. That one me take on physical exercise during the evenings and that park, and that is our main park.
And I would say that is the same across all parks. We know we did some work with lighting in Enfield. It was solar lighting. It's in the path. It just has a low glow, and it delineates the path. And you know where the start and end point is. So people will commute home from it. What they tend to do is not go through Enfield Park to their cars where they were parked in the autumn and winter. You could see from the counters it would drop off as it got darker and darker. What we did see is this lighting doesn't light the park like this lighting. It just shows a pathway. We probably extended that commuter hour for people to go through the park because people were making a conscious decision. Oh, I can see the end now. I feel comfortable walking along that line because I feel comfortable walking that distance for that period of time. So it changed people's mindsets and behaviours. It didn't increase the usage park all night because it didn't light it as you would have thought, but it enabled that extension by an hour or so of people commuting rather than walking all the way around it. Conversely, that changed people's behaviours to the point where they didn't walk as far because they weren't walking all the way around the park, but they were getting to the cars quicker.
That is an excellent idea what you come up with there, because I'd never even thought of solar lighting now, because you built some lovely footpaths around that area, and I know you can't light the old park up, but if some sort of solar lighting, I think it would encourage more people to walk down there.
When we look at that, so we did improve the lighting in the car park and we put CCTV. So that we know that has extended the usage of that by the leisure centre users and the people who are dog walking. So they're willing to come back as it's getting to dusk where beforehand they weren't. So there's things we can do, but we can't do everything at the end of the day.
Thank you.
I'm conscious that we've promised you lots of things today, and I've seen Caroline scribbling down, so we'll have that list of things. But the back walk sounds great, Councillor Squire. So actually, if you wanted to bring together interested communities in your local area, we do have wildlife organisations that are members of the network as well. So if something like a back walk or something in your local park would be good, then we can help you as hopefully our new advocates for physical activity after this session. Thank you, Chair.
Thank you, Rachel. Right, I'm going to ask the panel, I'm going to ask the members if they've got any more questions. Councillor Greenow.
Yes, thank you for the presentation. Now, the solar lights, with my councillor grant last year, I put them on the green at Wadham. It works very well. Got the idea from Enfield Park. And I got involved with the company. I can supply Councillor Craig with all the details on that. The second one is a short 300-yard stretch of road in Staine, one of my villages, and that has no lights. There's lights up to the end of a very well walked road, main road, no lights, 250 yards down the hill, lights again in the middle of Staten. I asked the DMBC Highways Lighting Officer, Craig Morris, if this would be possible to put 3 in. He said, no, it's not our responsibility. Now, I would welcome any assistance from your organisation, which I fully back, with helping with, I could get some private investment from local businesses and quarries, but if we can work together, but he seems not to think that is the possibility. It's not his policy. So I think we need a bit of joined up thinking. So I'll welcome what you're saying, and I would like to have some feedback, possibly with the interrelationships between highways, street lighting, and the idea of parks and small bits of roadway. Because what this bit of black space is in winter, nobody does it. But it's on the circular walking route in a very small village where there's maybe only 500 people live. But that is the one they use, and they don't use it in winter. It's just too dangerous. As simple as that. Okay.
I'll take that away and investigate and come back to your councillor on that one.
Thank you very much.
Thank you very much, everyone. Now discussions are finished, I would like to move to the recommendations. They are set out on paragraph 11 of the report. Does the panel feel like it has reviewed the information provided today? Can I ask if there are any additional recommendations? Can I ask the panel to note that creating and sustaining systems and environments for physical activity improves the health and well-being of Doncaster residents and communities and reduces risk factors for poor cardio health, and that the panel supports the Get Doncaster Moving place-based approach to reducing physical inactivity in Doncaster. Is this agreed? Is this seconded? Thank you, officers. Thank you for your time, and move to the next item. Overview and scrutiny work plan and the council's forward plan for key decisions, pages 27 to 44.
Hi, I won't take long on this. We'll just have a quick summary. Basically, just to let you know what's coming up in the next meeting. So it's early February. There's a meeting being undertaken on public health protection, which covers quite a wide range of areas, and we'll familiarise yourselves with that nearer the time. Regarding the forward plan, there are some decisions on there, but the information has already come to the panel looking around carers. That came to the last one. And main other areas are going to be around budget. Of course, that'll start next year through OSMC, and finance performance report. The next one's in December, and then March for OSMC. And we always say any member can put questions through the chair, and then they can take that to the meeting to make sure you're all able to have that input. So basically that just covers my area.
Also, I would like to propose that further information is brought to cardio health as part of the public health protection report, if appropriate, or a separate lived experience. Is the panel in agreement with this?
Yep.
I would like to now close the meeting and thank you for your attendance today.